Hi, I'm Dr. Karen Allen. I'm an optometrist at Premier Vision of Dallas. And patients ask me all the time, what kind of artificial tear should I use? My answer is always, it depends on what kind of dry eye you're having. So if it's just an occasional use, end of the day discomfort, or when you wake up in the morning, using a preserved artificial tear like a Refresh Relieva is all you really need. If you're using an artificial tear less than 4 times a day, you can use a preserved drop. So I like the Refresh Relieva. It also comes as Refresh Relieva contacts, but those are really the same thing. I also like Sustain, but I feel like the Sustain Ultra is a little too oily for contact lenses, so I wouldn't use that if I was a contact lens wearer. For patients who are going to use artificial tears more than 4 times a day, then I would recommend using something like a Sustain preservative-free. The Refresh Relieva also comes in preservative-free, and you can tell the difference because it will say PF right here on the label. So they come in bottles, but also they come as little vials. And so it just depends on what modality you like better. So if you're using an artificial tear more than 4 times a day, or if you have really sensitive eyes, then I would switch to a preservative-free modality. My favorite preservative-free artificial tear is probably the Mega 3 preservative-free. Again, it comes in a bottle as well as in the vials. This one is a little bit more oily too, so it stays on contact with your ocular surface for longer. And that's why I like it so well. But if you're wearing contact lenses, that's probably not the best idea. Now, there are a lot of viscosities that you can get with different artificial tears. So if you need a thicker artificial tear, like something that's going to last throughout the night, so for patients who get really dry in the morning, sometimes using an artificial tear at night is better. You can use a gel drop. Refresh has a gel drop, and also Therapeutic has a gel drop. The Therapeutic, I think, is a little bit harder to find, but these will blur you just a little bit for about 30 seconds, but they will remain on contact on the eye for longer. So it's a great overnight use. There are also ointments available like Lacrolube. Those are fine to use, but they really will make you blurry and they stay in your eye for a long time. So again, artificial tears, it depends on how often you want to use them and what kind of problems you're having. If you have any questions about this, come see me at Premier Vision of Dallas.